For those of you who don't know me, my name is Jimmy Padjuheshvar. I'm a doctoral student of physical therapy from Rocky Mountain University of Health Professions. Um, I've had the pleasure of working with a lot of positive role models, and I've seen people who take on projects that um, do a great deal of good for the world, not only in this country but also in third world countries. And one thing that I've learned is that humans can do amazing things, but when we are in pain, when we have physical pain, um, our ability to do good for the world or any other project that we have on our plates either slows down or gets stopped for a while. So it's really important that no matter what things we do in our life, that we understand the importance that posture plays into our abilities to live how we want to live and to achieve and do things how we want to. So this is an in-service that I did in Louisville, Kentucky during my last clinical internship, and it's titled Posture, the Other 23 Hours. Um, to define posture, the Cleveland Clinic does a great job at defining it. They say it's the position you hold your body upright while standing, sitting, or lying down. If you take a look around you at your workplace, at your home environment, or walking down the street, you might see people slouched a little bit. And when you see someone who has good posture, it's kind of different. And you're like, wow, look at that guy, or look at that lady, how they're standing up so upright. And it's because we have become comfortable with the fact that slouching is okay, even though it's not. If you go to a 9 to 5 job workplace where there's a lot of people sitting at computers, you may notice that a lot of people are kind of slouched over their laptops. And over time, this can cause a great deal of problems in the cervical, the thoracic, and the lumbar region. But there are ways to prevent these from happening. And what I like about this definition is that it says that it's the position you hold your body, stating that you have total control over your own posture. But it has to be a conscious effort to come out of those bad postures and maintain a more safe posture for your spine. Slide. In physical therapy, the healing process, I like to see it as an equation, and there's two parts to it: the therapist and the patient. When these two equations are working, or these two parts of the equation are working together, we're able to create lasting results for the patient. As therapists, we do all sorts of things. We evaluate, we educate, we treat, and the patient must do their part. They must be motivated, educated, consistent, using good form, and willing to break old habits. By motivated, I mean we have to do our part to motivate them, but they also have to have a need or underlying source for wanting to get better. By education, I mean that we have done our part to educate them, and they have done their part to show that they understand the concepts that we review with them about their condition. Consistent, they need to be practicing their home exercises program, their home exercise programs, and we need to get affirmation from them that they are consistent with those programs. And using good form is what this whole presentation is all about. And willing to break old habits is, you know, if for the past 15 years of your life you've been working at your computer with kyphosis, that's a habit. And if you're comfortable in that kyphosis and you're walking around with your head forward and your shoulders rounded, that's a habit that we need to break. So when these two parts of the equation are in harmony, we're able to have lasting results for our patients and greater patient satisfaction. One big thing that I saw during my clinical, so we'll start with this one, is forward head posture, and it's associated with greater stresses on the muscles that stabilize our head. Our head is pretty dang heavy, And if we keep it forward, the muscles in the back of our neck here have to do a ton of work to keep that weight of the head up. So over time, when these muscles are contracted, trying to keep your head up constantly, you're going to develop tight upper trap and levator scapula. And opposite to that, you're going to develop weak, deep neck flexors, such as the longus colli and the capitis. An interesting fact about forward head posture is in patients with temporomandibular disorder, it is believed that 85% of them have forward head posture. So it leads you to think, if you corrected that forward head posture, would it reduce the occurrences of TMD? Something interesting to think about. Next, we can look at this picture, and it helps us kind of put into perspective what a forward head posture it actually looks like. The blue line here signifies where your ear is supposed to be. In forward head posture, you have your ear at an angle from vertical, and sometimes when working with patients, I like to show them a picture like this so they understand what I mean by standing upright or having your neck in an upright position. Because for them, their position to them is upright, because that's what they've been walking with pretty much for a long time. A second position that I saw a lot during my clinical was this rounded shoulders position. It's interesting because you'll lay a patient down supine on the treatment table, and if someone has had rounded shoulders chronically, you will see that they're not able to relax their shoulders enough to drop the shoulders down onto the table. They stay in that rounded shoulders position even when they're laying down on their backs. This is associated with the tightness that has developed in their pectoralis major and minor, and opposite to that, weak serratus anterior and trapezius, because they have been in such a lengthened position for such a long time. Chronically, this can lead to loss of upper back extension. It can put so much pressure onto the rib cage that the rib cage is not able to expand normally, and thus breathing can be restricted. So you can see how many indirect problems you can have just because of postural deformity that can be fixed. And the last point here is, as we know, a lot of patients with shoulder pain and decreased range of motion in the shoulder come into us, and the first thing we should notice is the position of their upper thoracic spine, and rounded shoulders will probably be a contributing factor to their shoulder pain and decreased range of motion. The third and final position that we're going to discuss today is the anteriorly tilted pelvis. A lot of times I'll be walking down the street and I see a lot of people who have such a lordotic curve in their lumbar spine. And a lot of times those people also face issues like obesity and other problems that will put more pressure on the vertebral bodies of the spine. Even without obesity, you can see that anterior rotation of the pelvis or anterior tilt of the pelvis, we know kinesiologically that it puts more pressure on the vertebral bodies. This results in tight erector spinae muscles and hip flexors, and opposite to that, weak gluteus maximus and minimus, hamstrings and abdominals. So there's an imbalance anteriorly to posteriorly, and this imbalance over time is what gives patients the intolerable symptoms that they come and they see us to get treated for. So the big question is, what do we do now? Starting from day one of physical therapy, when the patient comes in for their initial evaluation, it's important to examine their posture, to thoroughly assess their motion and see what postures they are in when you have have them flex their shoulder up. What's their natural posture? Have them stand like they would stand normally if they were at home, and examine them from different planes and see what that posture looks like, what that normal posture for them looks like. And a majority of time you'll notice that there are certain clues, little corrections that you can make in their posture to help them benefit more from the treatment that you're going to prescribe to them. And these little clues that you notice are opportunities. They're opportunities for you to teach corrective exercises. And I'll go into these in more detail in a little bit, but these opportunities in this lecture are forward head, rounded shoulders, and an anteriorly tilted pelvis, which is also associated with weak abdominals. Explain to your patients the benefits of posture and of corrective exercise training into their daily lives. Help them understand the difference between vulnerable and invulnerable positions of the spine, especially when they're doing different types of activities, like lifting boxes or sitting down and twisting, and kind of teach them the importance of what it means to have a protected, neutral spine. Um, Also, emphasize conscious awareness of poor posture away from the clinic. Help them understand that in order for this equation that we talked about earlier, in order for this equation to work, in order for there to be positive outcomes with physical therapy, the patient has to do their part. They have to understand that the 23 hours each day that they're away from the clinic is their time to take what they've learned in therapy and to put it into practice. And the only way that they're going to get those lasting benefits are if they are faithful to their home exercise programs, if they ask questions when they don't understand, and that they use the tools that we provide them in the clinic. And also be sure to mention to them that these tools that we provide them are going to help them reverse this chronic pain cycle that they've had for so long, from the strain on the soft tissues and the pressure on the joints that this poor postural habit has placed for them. So the first corrective exercise that we are going to discuss today is chin tucks. Chin tucks is a great exercise if done correctly to help reduce forward head posture in patients with cervical pain. So the way I teach my patients is I tell them, imagine that your chin is on a plank and you're sliding your chin on that plank. You're sliding it back and then you're relaxing your head and sliding back forward. If you notice on one of the previous slides, one of the weaker muscle groups with forward head posture was the deep neck flexors, and this exercise will help increase the endurance of those muscles that are crucial for keeping your head in the upright position. And it's going to help relax those tight posterior muscles like the upper trap and the levator scapula, and the patient will start to notice that there's less pressure in their neck and there's less tension on those muscles. The next exercise deals primarily with rounded shoulders, and I like to show this exercise to my patients who not only have rounded shoulders but also work at a desk. Those who have the 9 to 5 computer jobs, who notice that they're slouching a lot throughout the day, and as a result their spine has become quote unquote stiff, not wanting to extend like a normal spine should. Their shoulders and their pecs have become so tight that laying down on their backs, like we talked about earlier, they're not able to relax those shoulders back. So to help them recognize how to take control of their spine motion and to know what improved posture feels like, there's 3 steps to this exercise. The first step I tell them is to just relax, slump forward, have that bad posture so you know what bad is. And then I say, now over exaggerate your posture or overcorrect. So they sit up straight and they get a little lordosis in their thoracic spine and kind of assume that exaggerated posture. And then I say, now just relax a little bit. And they relax and they get into that normal, neutral spine. Um, and I tell them this is this posture that you want to have as much as you can throughout your 8-hour workday. And I say a good thing to do is every hour upon the hour, do 5 slouch overcorrect exercises, and try to maintain that poised, relaxed third square over here. To try to maintain that as long as you can for the next hour while you're working. And most likely they'll go back to the slouch position. Um, but it is our goal to educate our patients in a way where they can catch themselves and they can say, "Whoa, I'm in my slouch position. I have to do my slouch overcorrect exercise so I can go back to being in a normal, safe spine." To correctively teach an exercise for the anteriorly tilted pelvis, we need to educate our patients on the importance of contracting the transverse abdominis muscles. In order to do that, I always like to start with an abdominal brace. So I'll have my patient laying supine like this and knees bent, and I have them place their hand exactly where this patient in the picture is placing her hands, and I say, pretend that you're blowing out a candle on a birthday cake. And as they blow out, they feel muscles contracting underneath their fingertips. And I say, these are the muscles that you want to keep contracted no matter what we're doing. If we're standing, if we're sitting, if we're laying down, if you're at home, if you're at work, you want to keep a slight contraction in these muscles. Not to the point where you can't breathe normally, but I tell them, I'm talking to you right now, I'm keeping those muscles slightly contracted. And then I go into talking how these muscles help kind of initiate the core contraction, that shell that protects our spines when we're doing different types of motions, so we don't suffer unnecessary injuries to our spine. Then, after doing about 10 sets of 10-second holds, so they actually understand how to activate and contract the transverse abdominis, we progress into the posterior pelvic tilt exercise. We all know that lordosis places a great deal of stress on the vertebral bodies. By teaching a patient how to correctively posteriorly tilt their pelvis out of that anterior tilted position and unload the vertebral bodies of the spine, they can understand what it means to get into a neutral pelvis position. So I have them work on that, and before we progress to close chain to open chain, I have them lay down this exercise, and this is one of the exercises that they take home with them, and it becomes a crucial part of their initial home exercise program. The following link will take you to an interesting video that was done. It's about a study that was done on college baseball players and how if they don't have adequate core strength, how that can result in a variety of injuries, even all the way up to the shoulder region. Um, so the investigators placed a belt on the athletes with a sensor, and the sensor monitored the position of the pelvis and its relationship to the athlete's core, and if it was contracted or not. And if the athlete was in too much of an anterior tilt or too much of a posterior tilt, the sensor would notify them so they could correct that and get into a more neutral pelvis. Pretty interesting study to explore into. I like to place a great deal of emphasis on the self-correction exercises the first couple sessions that I'm with the patient. But as we progress with physical therapy, we're going to be doing, of course, more challenging exercises. TheraBand exercises, lunges, dumbbells, machines, closed chain, open chain, just different exercises in different phases of treatment. But it doesn't mean that I have to disregard chin tucks, a neutral pelvis, or an upright thoracic spine. I can maintain these positions in all phases of physical therapy. And by reminding my patient to check themselves and to get into those good postures during those exercises, it helps to transfer that awareness to different parts of their lives when they're away from the clinic. The benefits are endless, especially when we talk about the core. During resistance exercise, maintenance of spine and pelvis position is one great way of stimulating abdominal muscle contraction and activating the core, kind of activating that shell that protects the spine and helps prevent um, injuries with different twisting motions and different bending motions that are very common in daily living. The following are some quotes that I received from patients during my clinical. One patient stated, "I am now aware of my posture at home and catch myself when I am slouching." We talked earlier a little bit about the equation to positive, long-lasting results. Not only do we have to do our part as physical therapists by providing education and the tools necessary, but patients have to do their part. And this quote kind of captures the whole essence of the equation. And when the two parts work together, you get positive results. Another patient stated, "Now it feels weird when I don't have good posture." Perfect example of taking a bad habit and turning it around 180 degrees, turning it into a good habit. And now that the patient understands what it means to have that good posture, when they resort back to their old habits, it just doesn't feel right. And the last patient stated, "I've been practicing my posture exercises throughout the day, and I've even shown it to my sister, who has bad posture too." As evidence-based practitioners, we're reading the evidence, we're reading all the scientific jargon, and we have to translate that in a way where patients are going to get the most out of what we tell them. Um, if you effectively translate that language to your patients, they're going to be able to internalize it, and patients will transfer that information to people around them, their family members, their coworkers, their colleagues. So what comes out of our mouths goes a long way and reaches a lot of different people's ears. As I close today's presentation, I want to challenge each and every one of you to speak with all of your patients, especially the ones with cervical, thoracic, and lumbar issues, and help them understand the important role that posture plays into their daily lives and how it can enhance their healing process. Thank you for your time.